Welcome to the Washington Week Extra. I'm Lisa Desjardins. As the pace of COVID-19 vaccinations ramps up, so is the rate of hospitalizations across the U.S. President Joe Biden is urging governors to enforce mask mandates as some states are refusing to comply with the CDC's recommended public health regulations meant to keep people safe. This as higher risk variants are silently spreading across the country. CDC Director Rochelle Walensky issued an emotional warning to people to follow precautions just a little longer.
I'm going to reflect on the recurring feeling I have of impending doom. We have so much to look forward to, so much promise and potential of where we are, and so much reason for hope. But right now, I'm scared.
Joining me tonight, 4 reporters covering this story: Wesley Lowery, correspondent for 60 Minutes Plus; Jonathan Martin, national political correspondent for the New York Times; Anna Palmer, founder of Punchbowl News, a political newsletter, and co-host of the Daily Punch podcast; and Ayesha Rascoe, White House correspondent for NPR. Welcome to all of you. Ayesha, let's start with you. How is the Biden administration balancing this so far mostly successful vaccine rollout, but yet with a growing number of COVID-19 cases?
In some ways, it seems like the administration is a victim of its own success or the success of the vaccine rollout, however much credit, people want to give them. But the problem is they want to have this message, and you heard it from President Biden again today, somewhat chastising people, saying he had said by July they think people could have small family gatherings, but it's not July yet, it's April, and people need to buckle down and, continue to wear masks and to continue to move to do what they've been doing going forward, and not to go back to life as normal, that it's too soon. The problem is, for a lot of the country, people are already going back to normal. They're not waiting until July. Things are opening up again. People are traveling. And that's just a very hard message to get through to a nation that seems really weary of the restrictions that they've been living under for the past year.
And I think I can speak for all of us here in Washington and say, in Washington, there is definitely a hunt for vaccines. It is definitely a high demand here for people messaging each other about where they can find it, how they can get it. Politically, though, first of all, what do we know about the message that members of Congress are taking to their districts? Are Democrats kind of touting success here? I don't hear Republicans talking about failure. Where does this fit politically? Is everyone happy? Is that why we don't see it in the headlines?
I think it's complicated. Like a lot of things, there's this partisan lens where you see Democrats, I think, are wanting to tout the fact that there are more needles in the arms, that Joe Biden has been much more successful in terms of deployment of the vaccine, and that's why there's going to be better times to come ahead. But there's still a lot of Republicans who are either deniers, some members of Congress who still haven't even gotten their own vaccine, even though they've been, able to get them for weeks, if not months. And the fact that you have a lot of Republican governors who don't want to take advice from Joe Biden or the CDC telling them that they need to have these mask mandates. So we still really have this partisan lens, and everybody on the Republican side is really looking to Donald Trump, who kind of raises his hand every once in a while, but basically just wanting to take credit for the vaccine, but not actually doing anything else to, try to get more people, particularly on the Republican side, where there is that vaccine hesitancy, where there does need to be more of an effort to try to get more Republicans across the states to actually get the vaccine.
Yeah, Jonathan Martin, we know that Republican men is the largest single cohort that's not getting vaccinated. When you talk to leaders of Republican men, what do they tell you about why they're hesitant?
Well, I don't think it was any accident that Mitch McConnell twice, at least that I saw last week in Kentucky, singled out just that group, Lisa, that you mentioned, people who look like him. Republican men are the ones who he encouraged to get vaccinated. I think it's a huge challenge. I think we're quickly moving from a supply challenge to a demand challenge. And I think we're never going to reach herd immunity in this country when we have 30% of Americans who won't get the vaccine. And I think that the CDC is facing real PR challenges on this because they are so consumed with, trying to encourage people to mask up, socially distance, not get too rosy tinted yet, if you will, that they're kind of, I think in some ways, underselling the benefits of the vaccine. You got to tell people that, this thing is going to be over more or less once they get vaccinated. You got to give them a reason, an incentive to get the vaccination. And saying that you still have to wear a mask or you still can't travel, I think gets in the way of that messaging. I think that is the most urgent challenge, or it's going to be here in the weeks to come, Lisa, getting people across the country, especially conservative skeptics, to take this vaccine. I think that's going to be the real challenge going into May and June.
Wes, what about another quieter challenge, the challenge of mental health, especially for healthcare workers who are still on these front lines? I know you've been covering that. Where do things stand?
Sure. One thing that I think it's easy to forget is that medical workers and nurses were already in a bit of a crisis, a staffing crisis before the pandemic. That we had an understaffed medical system across the United States of America, and for those who've been working in it, this year has been unlike anything else in terms of the horrors they've seen firsthand, the stress they've been put under, and so this is a problem that we're going to be continuing to see play out for a long time, no matter how many people get vaccinated or do not. But I've done a lot of interviews with medical workers over the last month or so, including Dr. Anthony Fauci, right around the anniversary of the pandemic coming to the States. And one thing they're very concerned about in this moment where you do see people starting to get vaccinated and significant amounts of people getting vaccinated is that life will start to go back to normal even before we've reached that herd immunity, and that it might drive another wave of COVID cases and COVID deaths. That everyone kind of going back to normal because a bunch of us are vaccinated does not, in fact, keep safe those who have not been vaccinated. And especially when we have additional versions of the virus that are out there, it's really important that as we start, going back to the bars and restaurants, seeing our loved ones in person, that is going to set an example that other people, some of whom are not vaccinated, might begin doing that as well. And it might fill those emergency rooms and those hospitals up again. You have to remember, our last big surge was right after the holidays when a lot of people broke some rules to go see their loved ones. And what the healthcare workers I've talked to are very concerned about what the summer brings. When people are back out and about, they feel as if things are safe because so many of us have been vaccinated, and how that could end up costing a lot of American lives.
Aisha, President Biden has laid out some very specific goals, and then he's added to those goals. But how important for him are the COVID-19 goals? And is the White House concerned about this surge perhaps getting in the way and leading to what we've seen in other countries, which is another round of closures?
Well, that would have to be a huge concern for this White House. But I do think that they are very pleased with the way things have gone thus far. President Biden's poll numbers when it comes to handling the coronavirus are basically through the roof. They're in the 70s percent approval rate when you look at across polls. So they have to be very pleased with the way things have gone. They have had this process of kind of under-promising and over-delivering, which is the opposite of what the Trump administration did. And so I think in that way, they feel like they have the trust of the American people right now when it comes to the coronavirus. Now, if you do have another significant wave, that will be tested. And whether people will continue to have faith in the federal government to deal with this it is a challenge.
If I could just see all four of you for one last question, easy one, yes, no, I don't know. Sitting here in this big empty Washington Week studio where I'm very privileged to be, I'm curious, just yes, no, I don't know. Do you think all of us could perhaps be back in this studio? How certain are you that this calendar year that will happen? Nod, no, unclear? Nod, yeah, everybody feels yes, exactly, good. All right, I was gonna ask this summer, but yeah, Aisha, what were you gonna say?
Yeah, I think so. I mean, with people getting vaccinated, as you said, in this area, people are, like you said, all the DMs are going, where can you get it? I think if people get vaccinated, I think we could be back in the studio.
All right.
Hopefully.
I agree. Well, it's a date. It's a date. Hope to see all of you here soon. Exactly. Amen. We'll leave it there for tonight. Many thanks to all of you, Wesley, Jonathan, Anna, and Aisha. And thank you to our wonderful viewers for joining us. Make sure to sign up for our Washington Week newsletter on our website. We will give you a behind-the-scenes look into all things Washington. I'm Lisa Desjardins. Good night from Washington.